Hi, everybody. Welcome. This is our third installment of EGAP's COVID-19 governance speaker series, where we feature research projects that have been funded by EGAP grants to Global South scholars who are contributing to a greater understanding of the ongoing pandemic. I'm Max Mendez-Beck. I'm the Membership and Meetings Manager at EGAP. And today I'm very excited to have with me Emmanuel Ayifah and Rebecca Nanaya Ayifah, who will join us to discuss the findings of the research project on the effects of the pandemic on the 2020 election that took place in Ghana. Before we get started, a couple of housekeeping things. You have the ability to unmute yourself, but please keep yourself muted for the time being. We'll have a Q&A session, or we'll have a Q&A part of the presentation at the end where you can unmute yourself to ask questions. But during the presentation, please keep yourself on mute. If you do have questions for the presenters, you can feel free to ask them at any point in time. We just ask that you type them into the chat and we'll get to them during that Q&A portion. This event is being recorded, and then we'll be publishing that recording on the EGAP website a little bit later this week, or probably early next week. So with that, let me present the speakers. We have Emmanuel Ayifah, who is currently the Deputy Country Director of SEND Ghana, a policy research and advocacy organization. He's a Senior Fellow of the African Institute for Development Research and Evaluation. Prior to his current position, he worked as a postdoc researcher and monitoring and evaluation specialist at the Center for Evaluation and Development at the University of Mannheim in Germany. His research is broadly focused on applying microeconomic analysis to development issues, with a special interest in impact evaluation of development policies. He also does political economic analysis and implements research experiments with a particular focus on health, migration, education, social protection, and governance. Rebecca Nanaya Ayifah is a lecturer at the Department of Economics at the University of Ghana and a senior fellow of the African Institute for Development Research and Evaluation. Prior to joining the University of Ghana, Rebecca worked with several organizations and institutions, including the Ghana Institute of Management and Public Administration. I see that there's people that are waiting to be admitted, so I'm going to do that real quick. So she worked at the Ghana Institute of Management and Public Administration. She's also worked at the University of Cape Coast, the University of Cape Town, the International Labor Organization, the UNDP, and the International Food Policy Research Institute. Her research is focused on issues of labor, education, health, applied microeconomics, and political economy. She has a special interest in impact evaluation of programs that focus on poverty reduction, gender, and political participation. And she holds a PhD degree in economics from the University of Cape Town in South Africa. So welcome to the both of you. So I'll hand it off to you, and you can share your presentation and we can get started.
Thanks, Max, and thanks, colleagues, for joining us to listen to our presentation. Let me just share my screen so that we can begin straight away. Yeah, I hope you can all see the screen. Yeah. Okay. Thanks once again, Max. So I want to use this opportunity quickly to thank EGAP for the funding opportunity, and also to thank those that really were helpful in the initial inception phase of the project. We had presentations to fine-tune what we have today: the Electoral Commission of Ghana, the Ghana Health Service, some faculty members, of course, of the respective universities, University of Ghana, GIMPA, and of course, some EGAP fellows as well. So I want to thank you. We are presenting a study that looks at a quasi-experimental analysis of Ghana's 2020 elections, focusing on the impact of COVID-19. I did this together with Rebecca, as Max did in the introduction. So what was the issue? What are we looking at? Indeed, in 2020, when COVID hit the world globally, COVID affected everything about life, including world democracies. So they were thinking about what happens to elections that were actually due in 2020. Some countries decided that no, we are holding on, we are no longer having the elections. Others, including Ghana, US, Malawi, decided that let us go on. I guess the main issue had to do with the fact that there were risks about huge infections if we are going to go on with the elections. And based on that, we sought then to find out what then will be the effect of COVID pandemic on electoral outcomes, especially looking at issues of participation and other issues in that respect. Just a little bit of context to that. So COVID hit Ghana in March, last 2020. That was the first experiment was in March, on the 12th of March. And so around 15th of March, the government then decided to put restrictions, and that is where we banned all social gatherings. And by the 22nd of March, the government decided to close all our borders, both the land and then both the airspace as well. When in around getting to the end of March, where the COVID infection rate was going up, government then decided that there needed to be a lockdown at certain places that infections were so huge. And so there was a lockdown at where we call the Greater Accra and Greater Kumasi metropolis. But be that as it may, still government still decided. The Electoral Commission of Ghana was discussing as to what to do. The fact is that it's a constitutional requirement that every 7th of December, every 4 years, elections are held. And 2020 was an election year. So there was that discussion, what are we going to do? Knowing that this is the first time it's going to happen in the 20th century where pandemics are so heavy in an election year. Every election year, what happens in Ghana is that ideally there's supposed to be a voter registration. The idea is that people who turn 18, because by our laws, you need to be 18 to get registered to vote. And so before the elections, people are actually asked to go and register. And so the Electoral Commission decided then to peg the voting, the registration around April 2020. But then owing to the pandemic, they then decided to postpone it to June. So it started from June 30th until August 6th. Even in that time, still there were concerns. Really, should we really go on with the elections or not? Are people really going to register to even vote at all? But eventually, all of this came on and voting happened on the 7th of December. I know that there were a couple of other concerns because during election time, there are a lot of political campaigning. And in Ghana, most campaigns happen physical, face-to-face. And if you have a lot of people, then the risk of infection is something that we need to be concerned about. Based on this, we decided to investigate to what extent COVID-19 will impact on voter registration, voter turnout, and voter shares of incumbent and main opposition parties. The idea for the third one is that sometimes policies that are turned out actually may have effect or impact on the chances of the incumbent winning an election or the opposition winning. And that is why we thought that would be good to look at to what extent most of the COVID policies and programs that came up actually would then have that effect. We collected data from two main sources. One source was from the Electoral Commission of Ghana, because they have the purview of our elections, and so they have all the data on elections that we can think of. We looked at elections before COVID and elections, of course, the 2020 was the COVID period. So we decided to step back to election period. That was 2020, 2012, and then 2016. Those are data we got from the Electoral Commission. We look at voter turnout, voter registration, voting population, flashpoint, and then parliamentary candidates. By flashpoints, we mean that places that almost every time we have some sort of chaos, and for that matter, is a sort of concern. Ghana currently we have 275 parliamentarians, and so we have 275 constituencies. Sorry, constituencies, 275. So what we see generally is that on average voter turnout was about 79% for the total eligible voters for 2020. I just really quickly just want to compare to just 2020, 2016, which was just 71%. So if we are just looking at the disparities, we saw some sort of increase in terms of voter turnout. I'll quickly move on because of time. What I said earlier is that we decided then to look at COVID and pre-COVID, and we also tried to break the constituencies into two, looking at lockdown and non-lockdown constituencies. So lockdown constituencies are the constituencies that falls within the geographic area of the greater Accra and the greater Kumasi areas that experienced the lockdown per the directive that came from the president. And indeed, what we see is that there's a statistical significant difference in terms of voter turnout when we are looking at the lockdown and then the pre-COVID and then COVID era, lockdown and non-lockdown. Similar results we can see when we are looking at the voter population 18 years and above, and then the flashpoint as well. In terms of the study design, theoretically, we try to base everything on the calculus of voting model. That really assumes, look at the cost and benefits of actually undertaking or participating in an electoral activity. Because we that sense that before somebody decide to vote or to register, we weigh the cost as opposed to the benefit. So that is the theoretical background that we're coming from. And also we did assume that people are concerned about the possibility of contracting COVID. And so we looked at to what extent if somebody is in a lockdown area compared to a non-lockdown area. Our assumption is that will be possibly influence somebody's decision to go and actually register and vote. I indicated earlier that as a treatment, because this was a quasi-experimental approach, what we did was to use the lockdown constituencies as treated, and then control groups were the non-lockdown groups. Later on, my co-presenter will actually talk much about the details about the specific methodologies. We did actually also hypothesize that indeed lockdown constituency will experience lower voter registration and turnout relative to the lockdown constituencies. And based on all this, as I said earlier, we then decided to then look at the impact of the COVID lockdown on the number of people registering, voter turnout, and voter shares of the incumbent and then opposition parties. At this juncture, I'll hand over to Rebecca to continue walking us through the estimation techniques and the results. Thank you.
All right. Thank you very much, co-presenter. So as my co-presenter said, so we were faced with a situation where the lockdown affected all constituencies. So we decided that we are going to use the imposition of the lockdown as a treatment variable because COVID affected all constituencies in Ghana. So with this, we grouped the constituencies into two. Those that came under the lockdown, which were our treated group, and then those that did not come under the lockdown, and they were the control group. So we did a simple difference in difference estimation, and these were the models that we used. So we have the first one, which is equation 1. This is just the estimation one. So the simplified form that we finally estimated, where we have our outcome variable, which is the EIT. So EIT is the number of people that registered per constituency, and then at a specific time. So for the voter turnout, we limited ourselves to the last 2 voting period, which means that for voter turnout, we did look at 2020 election and then 2016 election. For the number of registered voters, we look at 2020 election versus 2012 election. And we did this because for 2020, there was a new voter register that was compiled. And the same way for 2012. For 2016, a new register was not compiled. Rather, people who have turned 18 were added to the existing register. So that's why we used the 2. So as I said, so we have our ETI, which is our outcome variable. And with this, we look at 2 main outcome variables: the number of people that registered for the election in 2020 and 2016, and then voter turnout rate. So where the voter turnout is simply the total number of valid vote cast divided by the total number of people that registered for the election in the specific period. And then we also have the PJIT, which is the share of a party's vote in a constituency at a time interval. So this represents how much the main opposition party had, which is the NDC, and then also how much the main opposition, the incumbent government had, which is the MPP. And then we were going to be concentrating on the beta 4, which forms the effects of what COVID on our outcome variable. So those were our main variable of concern. We also did control for some constituency fixed. We did put in constituency fixed effect, and also control for some district level variable. For instance, the number of voting population. So we got this data from the Ghana Statistical Service as to the number of voting, so which means the number of persons who are above 17 years, so from 18 and above. So we control for us those ones also. So after doing everything, this is our outcome, this is our results. So we did one for the number of registered voters. We did not find the number of, we did not do the turnout for registration because we realized that in some constituencies, the number of people that registered for the election were more than the voting population. It doesn't mean that the Electoral Commission is wrong. It could mean that because the voting population was just an estimate that the Ghana Statistical Service gave us. So we decided to go with the real number of people that voted instead of looking at the turnout for the registration. So we realized that yes, the COVID lockdown had a positive effect on the number of people that registered for the election. So when we look at the last column, which is column 5, because that is where our interest is, where we have some controls and also constituency fixed effects. As we can see, it means that the COVID actually increased the number of voting by about 9,200 number of persons per constituency. And we're trying to find out how this could be possible. It could be because people had been under lockdown for so long. So when they had a chance to come out and register, a lot of them came out. So it could be one reason. The other possible reason is that in Ghana, until recently, we did not have a national ID card. So most people used the voter ID card as a source of identification card. So mostly when they have voter, a lot of people will turn out, not because they want to vote, because they want to have just the ID card so that they can use it for their banking and insurance transactions. Now, in terms of the voter turnout, we realized that COVID-19 had about 4% reduction, led to about 4% reduction in the voter turnout. As you can see in the last column, for the interaction between COVID, the lockdown, and then the time. So that's what we have here. Well, this was quite expected, looking at the fact that we're considering going out to vote as a cost to the individual. So using the calculus of both, if the individual knows that the cost of voting is so high, then there's going to be a reduction in the participation in electoral activity. So this was quite expected. Now, the last one that we did, as we said, was the impact of the lockdown on the vote share. So here, even though we had about 12 parties for the last election, we concentrated on the two main parties. So we have the incumbent, which is the current president, and then we had the main opposition party, which is the NDC, the National Democratic Party's candidates. And here we concentrated on the presidential candidates, not the parliamentary candidates. And here we realized that with a 10%, so it wasn't quite clear. So about 10% significant, we realized that, oh, okay, it had a positive effect on the opposition party, but it had no effect or no significant effect on the main incumbent party or the current president, which means that the lockdown imposition had no effect on the current president or the current election that we had. Now, we also decided to do a lot of sensitivity analysis or robustness checks. So the first one that we did was that we realized that for our treatment variable, that is those constituencies that were under the lockdown, we realized that about 50% of them came from the main capital, which is the Accra Metropolitan Assembly, and also Kumasi Metropolitan Assembly. So we realized that they might be driving our results. So we decided to exclude those two metropolis from our analysis. So that's what we have here. And so our results were consistent. So there's a negative effect of the lockdown, COVID lockdown on election in terms of the voter turnout. And also there's a positive result of the lockdown on the number of people that registered for the 2020 election. The last robustness that we did was that we decided that we were going to combine matching with difference in difference. So what we did was that for those constituencies that came under the lockdown, we picked constituencies in the control group, that is those that did not come under the lockdown, that were similar to them. So we did the matching, and then we carry out the difference in difference. And similar to the previous results, we realized that consistently, the COVID-19 lockdown had a negative effect on voter turnout and a positive effect on the number of people that registered for the 2020 election. So these are the final summary of what we have done. As I've said, we realized that yes, even though we had a lockdown and COVID, the number of registered votes actually increased. And as I said, because people were so tired, maybe that's just a possibility. So they wanted to come out, and there was no better way of coming out than going out to register. And then we also realized it has a negative effect on voter turnout. And this is in line with other studies that had been done in the US and then also in France. However, unlike the US one where there was incumbency advantage, for us, we did not have that. The government did not benefit from the lockdown restriction, even though it provided certain goodies to the populace, we didn't have any effect. But rather, the main opposition party had a positive effect from the COVID-19 lockdown. So from this, what we are saying is that in terms of health, when there's health pandemic, it's going to affect elections, and then we are proposing that in our part of the world, most of these voting and electoral activities are done in person. So if you can increase the number of polling stations that we have, or the polling centers, so that people will not fear that when they go out to vote, they are going to contract the COVID vaccine, or they are going to contract any pandemic or disease that comes out. We also said that we can also do electronic voting. Here, you can't do electronic voting. You have to be there yourself, or voting by mail. So these are some of the responses that we think that if it's put in place, especially in Africa, then whenever there's a health pandemic, in spite of the pandemic, political activities can still go on, and then our electoral system will be strengthened. Lastly, we are also saying that for both incumbents and also for opposition parties, their responses to political activities, especially during pandemic, are very important since it can affect their outcome in that election. So with that, we come to the end of our presentation. Thank you very much.
Thank you so much, Rebecca and Emmanuel. Yeah, very interesting findings. We have a couple questions. I guess we can start off with Dan. I see the question there, but can you go ahead and yeah, ask it yourself?
Sure. Thank you very much. That was a really fascinating presentation and really interesting work. I mean, the question, I guess, was answered because subsequent to my posting the question, You described the robustness tests you did when you excluded Kumasi and Accra, because they effectively were making the lockdown dummy into a proxy for urban or close to that. And so it was nice to see that the results were not overly changed when you did that.
Okay, thanks. Sandra, you had a question as well?
Yes, thank you for a very interesting presentation. I was just curious to hear a little bit more about the perception of the governing party in terms of how the public may not have necessarily had a negative association with decisions around the lockdown. So I was wondering if you could speak a little bit to why you haven't observed any, I guess, not so much neutral effects, but like negative effects in particular, because it seems like people had a positive response to the opposition party. So I'm just curious to hear a little bit more about how people perceive the governing party.
Okay, I don't know whether we can answer this or we should.
Yeah, I think we could go question by question, and then you can answer them, and then we'll go to the next question. Yeah.
Okay, so thank you for the questions. I'll start with Sandra's one. Yes, indeed, it was clear from the results that there was nothing like real incumbency advantage in here. Well, I'm speaking not in respect of the current situation, but I'm looking at it in 2020. I guess that's where your interest is. In 2020, I do not think that people's perception about the current government was really bad. Looking at the fact that, in the COVID era, like Rebecca indicated, government, the thing is that government was proactive in terms of the quick measure that came in. And there were some sort of relief that was being given to almost all of us. There was this free water delivery and then electricity. If your consumption was less than 50 kilowatts, you got some sort of consumption free. And so in that respect, you could say that, yes, people seem to sort of like what government was doing at the time. But the fact is that it did not really have any effect, as the results clearly shows.
Okay, so just to add up, I think people were thinking that the government is doing this because of the election. So, and it's true, because after the election, everything has gone back to how it used to be. The electricity and everything has stopped. So people are thinking that, oh, this one is just for us to change our minds. So they didn't really buy into what the government was doing. So it had no effect, even though the government made a lot of effort and it was recognized internationally as one of the best countries that have managed COVID, but still, to the voting population, it was just a political game that the government was playing with them.
And I think I take Postner's one as a comment. So thank you for that.
We have a couple folks who have their hands raised. So Bernard, you had a question?
Yes. I guess my question, I'm just looking at the outcome of the study, and I'm confused here, because from my understanding, even Bolgatanga constituency, which is far away in the northern part of Ghana, still also was also under the lockdown. So I'm wondering which of those districts are considered, or those constituencies are considered not locked down, and how that also influences the elections. The other point too is during the elections, the government also sent military across the Volta region, which was to block Togolese from joining in to vote. And I think that is a region that the opposition NDC has a stronghold. So that has definitely an impact on the NDC election in terms of the number of people that will be coming out to vote. And again, the EC also did not include the Guan constituency, especially Lolobi and then the Akwafu people who were supposed to be part of this. They did also vote, which obviously is going to affect the number of voters or the turnout on the elections as well. So my question is, did you consider all these factors in terms of your determination of whether there was an impact on both either the incumbent or the opposition in your analysis? Thank you.
Okay, thank you. So should we answer that? Okay. All right, Bernard, thank you. So in terms of your first question about the lockdown, if you remember, the president's directive was to the Greater Accra and then Greater Kumasi areas for the lockdown. I are looking at the lockdown, the March lockdown, and that is what happened right before the voter registration. For the northern region, I don't quite remember. It's also not documented that there was any lockdown in there. If even there was, maybe there were probably some localized lockdown, but we were looking at the government official lockdown that it's documented. In terms of the military in voter region and all, okay, these things came in during the voter, what do you call it? When the time that we were voting. Of course, that is why we said that, one, we were so much interested because it was just a lockdown. We use lockdown as a proxy for probability of having high COVID infections. And to the extent that the voter region was not really a lockdown area, we assume voter region as any of the other constituencies would be. So that's why they are part of the control groups anyway. But I mean, that is also acknowledged that maybe in terms of voter turnout, that could have in a way maybe contributed to it. But the fact is that we are looking at 275 constituencies. And so the number of constituencies in voter region, I don't know the exact number, but I do not think that that would be that substantial to really affect the result so much. I think the same explanation can be given to the Akwafu and the Lobi, which we know that is still under, so the parliament is considering that one as well. These are areas that are all under the voter and then the OT regions. So we did include all these, the voter and OT regions anyway, but then the fact is that I don't really think that it's going to have any big effect. But I don't know whether Rebecca has anything to say about that. But.
Oh, okay. So Bernard, first, the northern parts of the country did not come under the lockdown. So that is the fact. Secondly, in terms of military presence in the voter region and whether that could affect the vote share of the MPP and the NDC. So we did not control for, rather we control for constituency fixed effect. So if there's anything like that, which we couldn't observe, we were trying to control for that. And we also made provision for other controls. For instance, the number of people in a constituency were also taken care of. In terms of exclusion of other constituencies from the national voting. So, so as I said, in terms of the vote share, we were looking at the presidency. And this constituency, even though there was, I think they voted for the presidency, it was rather the parliamentary. Okay, yeah. The parliamentary that they were confused as to whether they belong to this constituency or something. So that's where the issue came in. Thank you.
Thank you both. We have a question as well from Oluwasola.
Yeah, okay. Congratulations, Rebecca and Emmanuel, for your very interesting paper. Yeah, my question is, I just want to, because I'm just looking at the results, I'm looking at what happened to voter registration and what happened to voter turnout. So I want to know, is there a time, for example, in the case of Nigeria, there's always a time lag between voter registration and the voting itself. So what is the time lag, 3 months, 6 months, between when you're supposed to register and the voting itself? And could there be possibility that there might have been changes in the lockdown in the different constituencies? within this period? Thank you.
Okay, thank you, Olu. So in terms of the time lag, for 2020, as I indicated earlier, the voter registration took place in June. And then the election by our constitutional requirement took place 7 December. So almost six months. But as I said, it was originally supposed to be April, but because of COVID and other things, that is how come the voter registration moved to June. Your other question, I do not know, but you asked whether there is going to be.
I'm just trying to say that, look, between June and December, right? Between June and December, is it possible that there has been some changes in the strictness of the lockdown in some areas or something like that? For example, in some places now, there might be lockdown, very strict in June, but in December, it may have been relaxed, something like that. Thank you.
Yeah, so the lockdown, it didn't go through to December. If I remember, I think it was just about 3 weeks or so lockdown. But then the fact is that even up to now, that we are no lockdown, up to now, the thinking is that, oh, COVID is in the lockdown areas. And so where you had been restrictions about nose masks and whatnot, when you travel beyond the lockdown regions, people will just go about their life as usual, normal. So that is why we still use the lockdown areas as a proxy. And indeed, it's true. Even now, if you look at the COVID infections data, it is clear that the lockdown areas currently still have the high infections. So it's just a proxy for COVID infection. If you are locked down, you know that, oh, if I don't take precautions, I'm going to be infected. And so I'll be restrained from going out to register or to vote. Thank you.
Ezekiel?
Thank you. I want to commend the wonderful efforts of our two presenters. They have done very well. And I think this work is applicable to most of the African states. My question is the impact or the role of the mass media or the social media in influencing the election. To what extent can we say that social media also have an impact considering the lockdown? Because that's another short way or a common way the political class is using to mobilize voters now or to create a powerful voter education. Can we really establish the nexus between the social media or the mass media and the lockdown in this election in question? Thank you very much.
Okay, thank you. So in terms of the role of the media, of course, generally, the media play a very key role, active role when it comes to, development in general. And when it comes to elections in Ghana, the media, they take very active stage in that. But in respect of your question as to how the role of the media in having an impact on the lockdown, this was just a presidential directive that these particular locations, Greater Accra and Greater Kumasi, you have to go on a lockdown because we've realized that the COVID infections rate are high. And so it will really not be the media going out to highlight that will really have much influence anyway, because people sometimes were traveling from non-lockdown areas to lockdown and they were restricted, that you cannot move in. So we even have situations where even goods were not even going out or coming in. So all that the media could do as a media person, well, of course, we were in the house watching television and listening to radios and all that. Even they couldn't really go beyond and where they were their area of jurisdiction. And so that is it. I do not really think that it had any effect. And then the fact is that even with that, I believe that that's why we assume that in some of the controls, the fees effect, we are just trying to look at all other things that are likely to influence. So if the media is one, that would also play in there. But I understand, maybe we could also look at this further, but not really in terms of throwing in whether there's a media or no media in other places. There's media, the media landscape in Ghana, if you know Ghana very well, we have proliferation of media. So everywhere, even in the little communities, there are community radios and all. So thank you.
Great. Yeah, thank you all for your questions. We still have a little bit of more time, and I saw that Rhoda from CDD Ghana had a question, but unfortunately it seems like she dropped out. Hopefully she can join us again and ask the question. But we also had another question from Bernard in the chat here about the changes in voter registration requirements. You might have slightly addressed these when you discussed the fact that the voter IDs were something that people might have been getting because there were new requirements that were put in place, but could you discuss that a little bit further?
Okay, maybe I'll talk briefly and then maybe Rebecca will come in. So of course, for us, we didn't look at the changes because that was going to be complex. You know, every year, 2020, 2012, 2016, 2020. Every year there are changes. That is why we're basing everything on the voter behavior. That is from the theoretical perspective. We're looking at the fact that, I mean, you consider weigh the benefit and the costs before you go out to register and then to vote. So all things being equal, looking at, I mean, all the different requirements, people are treated the same. So would you still go out to register and then to vote? We understand that even current the 2020, there were issues about whether you can use that a passport or so. I mean, all those things, I mean, came up. I remember there was another results, I mean, similar this particular study, but we didn't present that result. I think that is where we are really also looking directly asking people whether they'll be willing to go out to register and to vote. I mean, that presentation is not here, but if I remember clearly, you have a huge proportion saying that yes, they'll be going out to register and vote. That was even before the actual registration had kicked in. And so maybe Rebecca can also add on.
All right, so thank you, Bernard. I can't remember what took place, but I remember it was a court issue and people were later on allowed to register, right?
Yeah, he's looking at different requirements.
What between
So, you know, you can.
So there were issues or other whether you can use the national health insurance card to register. And it became a court issue where people were saying that because as I said, until recently, we did not have a national ID card. So personally, I used my passport to register. Some people were, and even that, I don't think it's had any effect because even if you don't have any form of identification, you just have to go with somebody who will identify you and say, oh, okay, I know this person, he stays around me, Mr. Ghanaian, and I have registered. Once you get those, so I'm not really sure whether they change in the requirements for registering to vote will have any effect on the results.
Just for me to chip in and explain what I mean by the requirement. One of them was the passport. So you need a passport, but your birth cert wasn't a requirement. So and the debate was, why would you say somebody, the passport, before you get a passport, you need a birth certificate to get a passport. But you could use your passport to get voter registration, but you cannot use your birth cert for that. That was another question besides the what do you call it, the health insurance card, or using the health insurance card. And so, and you know, unless somebody is planning to travel in Ghana, many people don't have passport, and that's a big question. And also
Yeah.
as regards to whether people could, you could have somebody to prove as evidence whether you could vote. There were a lot of cases in my area of, especially in the northern part of Bolga constituency. Some people had this, they were known in the community, but they had problems registering because the fact that they had lived in Accra for a while and they were coming back to register. So there was some kind of discrepancies in terms of who is supposed to be voted. And the people in the community knew the person. But because of these requirements, it makes it difficult for people to actually get into participation. I don't know how much that could have affected the results, but I'm just thinking if fewer people were limited because they could not produce passport and they could not get somebody to prove that they were part of, they were from the community, then that could also affect the number of people that will vote, and then the number of people will register and the number of people that will vote.
Yeah, I mean, these are things that I would say they are systemic things that I know almost every election year it comes up for discussion and all. But then the good thing, if you look at the results, if you look at voter turnout for all the 3 years, you could see 2012, if it could be projected, 2012, 80%, 2016, 71%, and 2020, almost also 80 also percent. If you even still look at voter population, the descriptive statistics, if you look at the voter population, yes, this one. If you look at the voter population too, you could also see a similar trend in there. But I do share with your view. These are some of the things possibly, if you are looking at maybe what prevented other people from getting registered. Like I said, the other paper that we are looking at, people's willingness to go out to vote, sorry, to register. I mean, those are some of the things that could probably use to explain those. But this is purely data that we got from the ECR with the total number registering and voting. So that is, but your point is valid in terms that using that to explain the context. Yeah, but I don't think that will largely affect the results, because mind you, the control is lockdown and the treated is not being under lockdown. And then we are looking at all the outcomes that we are interested in. So thank you.
Thank you. Yeah, we still have a few more minutes. If anybody still has any other questions, we can get to those. I'm still struck by the puzzle, I guess, of in the lockdown regions, there is an increase in voter registration, but then lower voter turnout. And so I'm curious as to if the people are assuming a cost to go out and vote, but that the cost doesn't seem to be the same when they go out and register. And like you said, the potential explanation is that people are like in their house and they need to go out. But if that's the case, you would think that they would also want to go out and vote. So I'm still struck by that kind of puzzle there.
Oh, okay, so what I can say to that is, so the lockdown ended in around April or early May. No. Okay, so by the time the voting took place, I think people were already out. They were not under. I see. So they're already out. So now there was no need for them to want to go out because they're already out. Yeah. But for between the registration and the lockdown, I think they've been locked down for some time. So maybe that could explain why we had that.
And then like Rebecca initially explained, still using the voter theory, the fact is that there was an incentive for people to go out to register because they needed the card for other things apart from just going to vote. Yeah. So that was an incentive enough for people to go and register. But beyond that, people really sometimes they didn't care.
Yeah, that makes sense. Emmanuel, Rukundu, you had a question?
Hi, not a question, but just congratulating Emmanuel and your co-author sorry, I think, yeah, Rebecca, on your paper. Well, it's really fantastic. The key thing I'm wondering about is, so why do we see the results we're seeing? So what was the actual issue happening about the lockdown? Was it about restrictions in movement? Was it about health concerns, health consciousness, about crowds and crowd control in terms of in that dimension? Was it about I think also what Max is saying, you know, it could also go the other way around, you know. Is it about some kind of euphoria of after lockdown? You know, once people are coming from the lockdown, then there's a bit more euphoria, or, you know, people calling it the Freedom Day or something like that, you know. So I think, Max, if you know, we're doing the same kind of work in Uganda, which has more or less, yeah, it's a couple of months behind yours, but we hope to have some, you know, complementary results on this kind of thing, and seeing also what's happening. It's more or less the same scenario, same landscape, with a couple of counties under some strict lockdown, others not, but also trying to figure that out with another kind of field experiment to see what was actually happening. So it would be good to try and figure that out also in your study, and then we can compare notes much better. And let's continue talking about this. I'll drop you an email, Emmanuel and Rebecca.
Yeah, sure. You're welcome. I think it's good we link up to compare notes and to see, to take this forward. Who knows, we could even look at other countries in Africa. But in terms of the what the lockdown meant, maybe I'll leave it for. Okay, so the lockdown, basically, you said it right, it's about restrictions of movement. And that is what was the difference between the lockdown and then the non-lockdown areas. All other areas also had the same restrictions that lockdown areas had, in terms of social distancing, in terms of wearing of nose or face masks. We had it across Ghana, but in the lockdown, you were restricted, except you were to get groceries, that you could just go out. I mean, you were just in the house, you couldn't move just to be going anywhere. You couldn't go to, you know, church. Ghanaians are quite religious. You couldn't go to church. You couldn't just decide to go and see the physician just anyhow. I mean, you could do that because of health reasons, but you need to give a compelling reason before you could go out. People were planning to travel, and they got to a place and then they were asked then to go back. You can't. There were even times they were looking at even trying to prosecute other people, except essential services like people in healthcare, health personnel, they had to go to work. And then the security and other organizations or agencies. But with that, aside that, everybody was supposed to be locked down. They said you had a compelling reason to move from your home. Thank you.
Oh, okay. So Iman, so the lockdown was based on the number, I think it was based on the number of COVID cases that existed in a district. So the lockdown was, so if you have a higher, those epicenters, they came under the lockdown. So it was more of the area that we felt, the government felt, it's not even felt because it's the number. So the government knew had a higher number of COVID infected cases that came under the lockdown. So with the lockdown, you can't go out. We're not allowed to go out. We're asked to be in the house. And I think it got to the point they were even distributing food so that you don't go out to buy food. Yeah. So if you want food, the government will bring in food, especially in slum areas, so that they are not supposed to come out. Unless in terms of, I think for only health reasons, you want to go to the hospital. So yes, so the lockdown, that's why we could use it as a proxy for the number of infection, because it was based on the number that those districts or areas came under the lockdown.
In fact, let me just argue, because someone may ask why we didn't use actual infections for. But the fact is that the COVID data was not per constituency. So, I mean, if we had constituency level, then that would have been easy. but that wasn't the case. And even for districts, you see, the fact is that at that time, we didn't have a lot of test centers. So, I mean, people went to a few places to test. So I might be from one constituency, I had to move, of course, to the other to test. And so based on all that, I'm sure that's why the government had a sense of course, people are coming from particular sort of area are infected. And so let's classify these ones and then let's log them to contain the infections. Thank you.
Okay.
No, and I think it's great that Emmanuel you were able to join us today. Emmanuel Rukundo is also a recipient of one of EGAP's grants for the COVID-19 Governance Series, and so we're very much looking forward to hearing your presentation sometime in the future when you have your results to share with maybe the people that are in this car will be interested in participating or in joining that presentation as well. I think that's something that's great from these grants, is that we're getting researchers to talk to one another from different parts of Africa. Sandra, you had your hand raised. We have like 2 more minutes, so I think this could be our last question.
I feel like there's something about the end that generates more questions typically, but I'll be very quick and brief. I was curious to hear if you could speak a little bit to kind of the intersection between, places where you had restrictions and places where you did not, and the implications of electoral violence. Maybe projecting on this particular, not projecting, but kind of from your findings, was there violence in more places where there was lockdown relative to those where there wasn't, or the other way around? And what kind of legacies do you think this particular COVID period might have for future elections and the intersection of elections and violence? Maybe thinking of the next election cycle coming up.
Okay, thank you, Sandra. So in terms of your first question, interaction between lockdown and non-lockdown and implication on electoral violence. As we indicated, the lockdown was way before the main election. And so in terms of how that will really affect violence, we really did not see any such. And indeed, in fact, what we witnessed in 2020 during the elections is just the normal hotspot areas, whether lockdown or non-lockdown, that we still had those hitches or glitches. So it was really not an issue of, because people have been locked down for quite some time, and then they really want to come out, and so that would either promote more violence or otherwise. So that wasn't. And your question about implications of the current COVID pandemic, that is why we, in our recommendations, we are looking at the fact that it's about time Ghana and possibly other African countries, we have to look at other ways of voting rather than always the physical means, the face-to-face or the physical means of voting. We do understand the systemic challenges with internet. If you want to vote online, if you want to vote by email, we understand all those systemic challenges. But I mean, we can plan in such a way that places that have very good facilities, we can, of course, kind of pilot or start that. And with time, once we have the needed infrastructure, we can move to others. There's something good that the Electoral Commission did for 2020, recognizing the COVID issue. I know that they tried to expand the number of polling stations in the constituency. I think that is what also helped, because I remember going to vote, and the place that I voted the previous elections, this time around, I went and there were, I think, 4 or so stations, just so that people could space out. I think these are some of the things that, if it's done, is going to help in future elections where there are pandemics. But we are praying and hoping that we wouldn't have such difficult situations that we find ourselves in 2020. Thank you.
Yeah, I think we're all praying the same thing. I'm going to, well, I think we're at time. Thank you all. Thank you, Emmanuel and Rebecca, for such a great presentation and for staying on and answering all these questions. Thank you to all the participants for joining and for all your great questions. I wanted to just share the link here in the chat, which has information on the different projects that we've been funding, including this one by Emmanuel and Rebecca, and that will be where we will be sharing the recording from this presentation sometime next week. And I'll also be sending out an email to everybody here on this call and everybody who registered for this event with the link to the recording. If you have any questions that you want to ask Emmanuel or Rebecca, or that you have any questions about this COVID-19 series, feel free to write to me or to EGAP. You can do so in the follow-up email that we'll send out. You can respond to that email where we'll send out the link to the recording. So thank you, everybody, once again. Thank you, Emmanuel. Thank you, Rebecca.
Thank you.
Thank you. I want to thank all participants too for their time and for everybody. Thank you.
Okay, thank you, Max. For your
Thank you,
questions.
everybody. Okay.